Welcome back. October is Breast Cancer Awareness Month, and joining me now to talk more about healthcare and the importance of awareness are two doctors in the Women's Hospital system. Good morning. I'm joined by Jamie Patterson and Lindsay Fovo. Doctors Jamie Patterson and Lindsay Fovo, thank you so much for joining me.
Thanks for having us.
So first off, how do we even get past the stigma of wanting to talk about breast cancer? Maybe you've known somebody impacted, you've been impacted by it, but just wanting to even talk about it or get help. How do we get past that stigma that's in the way sometimes?
I think you have to understand statistics. When you know that 1 in 8 are involved, you really can't ignore that. I think you have to be an advocate for yourself and end up in a better spot if you unfortunately do get that diagnosis.
And it impacts so many women and men, so I do want to throw that out there. Breast cancer does impact men, for those who are not aware. But what are some of the symptoms that you even begin to recognize at home, maybe before you even go and see a doctor?
Actually, a lot of women don't have any symptoms. A lot of them, thankfully nowadays, are found so small on a mammogram, they may not notice anything at all. But if they do notice something, sometimes it's a lump, or it could be dimpling of their skin, nipple discharge, sometimes, pain, or just feeling that there's something different.
So since there aren't any symptoms, when is breast cancer usually detected, or in what ways? What situations do you guys detect breast cancer? If there's nothing at home that triggers you to go in, per se?
I think having an open dialogue with your primary care doctor or your OBGYN, especially regarding your family history. The average recommendations are for you to start doing a screening mammogram when you're 40, but there are some special circumstances if you have family members who've had breast cancer under the age of 50 where you can start your mammograms early. But they're not going to know that unless you bring that to their attention. So you really need to be open about your family history and what's going on with your body.
Now, what should you do if you do find a lump at home, like if you're, doing your self-breast exams?
I would say call your doctor right away. Typically, they're going to want to do an exam and get some imaging, like a mammogram or an ultrasound, to evaluate what it is. It's not always a cancer, but you certainly want to make sure that you know what it is.
Now, speaking of mammograms, talk about the importance of actually getting the mammograms done. I know any type of exam can sometimes, depending on the person, be a little bit intimidating or scary. You don't know what the procedure looks like or how it's going to impact you. So talk about the importance of actually getting a mammogram done.
It's very important. It can be intimidating. It's a little unnerving to be going into an exam room and, disrobing, but it's very important. Sometimes we forget as women, I think, that we're trying to take care of everybody but ourselves. But you can't take care of everybody else until you take care of yourself. And so when you're, thinking about all the things that you have to do and trying to make room for something like an exam for yourself, you should keep that in mind too.
Now, if you're someone who don't really know your family's history, how do you know if you're high risk, per se?
Well, I think that's hard. There is actually a special exception. So if you're adopted, you are eligible for genetic testing because that is a very big unknown for you. But I think that having breast self-awareness is really key, and knowing what your normal is so that you know when something is abnormal.
Now, what are some resources available to, of course, women, but men too, but just anyone who may be curious about breast cancer, again, maybe know a relative or friend who've experienced or are dealing with breast cancer currently, or just know somebody impacted by it? What are some resources that can help?
I think Women's Hospital has stepped up with regards to having a big social media and website presence to give you that information. And luckily, they really have doubled down on the resources here in Baton Rouge and what we offer for the greater community. So I pride our work at Women's Hospital on the fact that I think, and I'm biased, that we have the best radiology program, and then we don't isolate it to our hospital. We actually do outreach with our mammo coach, so that quality level of care is brought throughout the state as well.
Now, I have to ask really quickly before we wrap, what are the two most common types of breast cancer?
So there's two types. There's invasive ductal carcinoma and invasive lobular. And those are just designated from which parts of the breast the cancer originated.
Gotcha. Well, thank you so much, ladies. Dr. Jamie Patterson and Dr. Lindsay Fovo, thank you so much for joining me this morning to talk about breast cancer awareness. Of course, we'll have this information, any additional resources, tips for self-care and breast exams at home, and any other information that will be helpful to you. Thank you so much for joining me. Stay right there. We'll be right back after the break.